Hello everyone, welcome to Starling Diagnostics YouTube video channel. Myself Mehdi and we have with us Dr. Newaz. Hello Dr. Newaz.
Hi, Imran.
How are you? So Dr. Newaz is the medical director and the primary care provider here at Starling Diagnostics. So today we'll be discussing about the hypertension. We know hypertension is called the silent killer. Why it is so? So we will be going through some of the tips to maintain our hypertension and our lifestyle. So let's go over it to Dr. Nawaz. So can you explain us about the hypertension?
So hypertension. So I will try to explain it in layman terms so that everybody understands. So
Sure.
hypertension. So in the past, the criteria for hypertension was anything blood pressure above 140 systolic and above 90 diastolic. So recently, after a lot of research, they have changed the criteria because younger patients are having more, complications from hypertension. So now the decision is we have to start treatment earlier or start at least addressing the blood pressure earlier. So right now the cutoff is normal is 120 over 80, and less than that. And from 120 to 130 is considered like borderline hypertension, maybe pre-hypertension. Or elevated blood pressure. And from 30 up, from 130 to 140 is called stage 1 hypertension. And from 140 to 150 is stage 2 hypertension, and so on, so on. So what that means is that we have to start addressing it earlier. Whereas in the past we were saying, after just started 140. The reason is the complications of that. So why it's called silent killer? Because a lot of times we don't know. Believe it or not, about 1.3 billion people in the world have high blood pressure. And about 46% of them don't know they have high blood pressure. So it is silent. So people don't know about it because they don't have the symptoms, right? So that's why it's called silent killer.
Oh wow, it's alarming actually. So according to statistics, in alone 2021 in US there are 691,000 deaths that contributes from the hypertension. So what are the causes and the risk factors of the hypertension?
Okay, so most of the time there's no specific cause for hypertension, so that's why it's called essential hypertension or primary hypertension, meaning there's no specific cause. It could be age-related, it could be the diet, or there's no specific cause to it. 10% of them, about 10%, have secondary causes, meaning some kidney problems that leads to hypertension, or some hormonal problems like pheochromocytoma that leads to hypertension, Cushing syndrome that can lead to hypertension. But the ones that are primary hypertension that has no cause, it could be genetic link to it. If you have family history, then you could get it. But lifestyle has a big factor.
So how do we diagnose these things?
Okay, so diagnosis is obviously checking the blood pressure. When you go to a doctor's office, then that's when you get diagnosed. So there's different criteria. So at the first visit, the doctor may not diagnose you with hypertension, even if the blood pressure is high, because sometimes if you go to a doctor's office, your blood pressure could be elevated, and there is this disease called white coat syndrome. So when they go to doctor's office, blood pressure shoots up, but then when you're at home, blood pressure is normal. Okay, so that's why the recommendation is not to treat the first visit. So the treatment starts like over 2 to 3 visits. The diagnosis happens over 2 to 3 visits because you want to bring them back and check it again, unless it's really high. So say if it's about 180 or diastolic 120, then you just one visit you could just say that this patient needs attention, this patient needs treatment. At home, you could diagnose yourself, or you could at least monitor yourself by checking blood pressure at home. There's a few ways to do that with a blood pressure monitor. You have to be like upright, sitting upright. Your hand has to be at the level of the heart, and then you monitor and try to avoid any caffeine or coffee before checking the blood pressure, because that can bring the blood pressure higher, give you a false reading. And then the normal recommendation is to check it 3 times, like 1 to 3 minutes apart, and then take the average. That's when you know if you have high blood pressure or not.
Oh, wow. So, what are the impacts on our health if we have the blood pressure?
So the blood pressure, so to make you understand, so blood pressure can lead to heart problems, stroke, kidney problems. Okay, it damages all the blood vessels. Okay, and so when the blood vessels, these are very very small blood pressure blood vessels, right? So when the pressure is too high, they get damaged, and when the damage is there, the body repairs itself and causes more narrowing of the blood vessels, and that can cause worsening of the problem, and it leads to end organ damage, meaning you could have heart attack, stroke, kidney problems, and then a lot of other even lung problems and all that can
Okay,
happen.
so it has certain implication on our health. So certainly it can be prevent if we can identify this thing earlier.
Yeah, so normal recommendation is to do diet and exercise. So if we follow a healthy diet, meaning like a Mediterranean diet or a DASH diet. So DASH diet is what, like just increasing vegetables in our diet, increasing nut intake, nuts, whole grains, good fats. Okay, so like vegetable oils, nuts have good fats. Those, if you, and then fruits, you include fruits in the diet. So a lot of fruits, vegetables, and good fats. If you include that in your diet, that's considered a healthier diet, and that actually helps bring down the blood pressure. Other thing is exercise. Okay, so normal recommendation is 30 minutes of moderate intensity exercise, 5 days a week, total of 150 minutes, because people who are sedentary or not very active, they're at high risk for elevated blood
Right.
pressure. So definitely activities will help. So diet and exercise is the first treatment. And then, along with that, you may need medication to bring down the blood pressure also.
Right. But until and unless we check the blood pressure and it's been certified by the physician, we cannot take the medicine.
No, so definitely you have to consult with the doctor, because
Yeah.
there are so many different types of medication. Depends on what your underlying problem is. Sometimes if you have kidney problems, it requires a different type of blood pressure medication. If you have diabetes, then that requires a different type of blood pressure medication.
Right, right. So you're talking about diabetes and blood pressure. Does it has any, correlated issues?
Yeah, so having diabetes causes increased risk for complications like heart attack and stroke. So normal recommendations, if you have diabetes, then you have to start treatment, or start talking about treatments earlier and take it more seriously, because there's a scale that we check as 10-year mortality risk, cardiovascular risk. Okay, so if that's high, and that's high when you have diabetes and all that. So if that's high, then you have to start treatment as soon as possible.
Okay. So we understand the intensity of this hypertension. So what is your generic suggestion for our viewers? Since this is a lifestyle disease, so there are certain issues that we can change to control our high blood pressure or hypertension. And if someone have any history from the family, does it impact?
Yeah, so family history definitely plays a role, but definitely we need to check, take this blood pressure more seriously. A lot of times, patients are reluctant to start medication, which is fine, but you have to address at least the lifestyle changes. You have to, until then, it's not good. So you always start with lifestyle changes, diet and exercise, and then routinely check your blood pressure. If you need to be on medication, it's better to take medication.
Right. So thank you so much for this informative session. We will be coming up with new videos with health tips and lifestyle diseases soon in every week. So tune with us, and if you like this video, just hit the like button and share the video with your friends and family. Thank you for being with us.
Thank you.
Thank you.